the number one priority of our foreign policy is to protect the American people. We cannot and will not allow any cases of Ebola to enter the United States.
This facility is for American citizens. We are not Wakanda.
What you see as a debate in Kenya is lack of information.
American planes are landing Kenya, and the High Court in Kenya is demanding for answers. The public is accusing Kenyan government of turning Kenya into an Ebola specimen. Today, we uncover the deal that has pushed Kenya into one of the most public health controversies in 2026. This is what is happening in Kenya at the moment. Let's go back to how this story even began. In late May 2026, President Trump came out with a new dramatic Ebola policy. He said, instead of bringing potentially exposed citizens, they should be quarantined in Kenya. Mind you, Kenya has never had a record of Ebola in their country. They are meant to build a 50 isolated bed space for the citizens. 30 American health personnel will also be there to help in the quarantine process. The target was clear: American health workers, American health personnel, and American military to come and help curb the Ebola infection. But then, for Kenyans, this was a very different story. Welcome to the Finance Podcast, and it's Finance with Abbas. Don't forget to like, don't forget to share, and don't forget to subscribe to our YouTube channel, the Finance Podcast, for more finance content like this. A video where the Secretary of the United States government was speaking, saying that they would not allow any Ebola infected person to come into the country to avoid breakouts, was speculating the internet. And on the other hand, another video where the President of the United States was saying that they have to quarantine them in Kenya was also spreading. Now, Kenyans saw this in a very different route. They were like, why are they bringing Ebola-infected Americans into our country? They came out on June 1st. They were like, we can't accept this. Why are we the ones taking the risk? Meanwhile, America has more health amenities. They have more health workers. They have more equipment. Why are we the ones suffering? Why are we the ones taking the risk for them?
Something else that I know is concerning people, because it's on the news, is Ebola. Our number one obligation, we're involved in foreign policy, but even our foreign policy, the number one priority of our foreign policy is to protect the American people. We cannot and will not allow any cases of Ebola to enter the United States. And so the State Department and other agencies represented here, the Centers for Disease Control, HHS, others, are working very, very hard to contain this crisis to the countries where it's currently located, particularly the Democratic Republic of the Congo. And so we've surged assistance to make sure that is being contained there. And obviously, multiple agencies involved here are also very involved in tracking people, just to make sure that nobody comes into this country that has Ebola and creates a problem for us. And we feel like we've got good efforts in place to do that, and Americans should feel assured that the President and his administration is doing everything we can.
Almost immediately after this video was spreading online, Kenyans began to ask questions. If America has one of the most advanced hospitals in the whole world, why are Kenyans being asked to take the risk? The perception spread rapidly, and then everybody was asking questions. So on June 1st, the first protest was held. You could see Kenyans moving around the streets with placards of, we don't want Ebola in our country, Ebola must go. You could see them wearing Ebola outfits. And then the police reacted by pouring tear gas and then opening fire at them. The message from Kenyans was very simple: keep Ebola out of Kenya, because if any outbreak happens, we Kenyans are the ones that will take the risk. Business owners warned that tourism could collapse in Kenya because of bringing the facility into Kenya. Nanyuki is one of Kenya's major roads to the tourist center, to the safari center. The fear in the hearts of people from Nanyuki was no longer just about their health, but about their livelihood. These people are dependent on these tourists to come to their country. Now, when they come to their country, they have to buy their food, buy their clothes, buy their stuffs, and then this gives them a source of income. Imagine that particular area has been set to be an Ebola testing area. Nobody will want to use that route, and then they're going to lose businesses.
I want to ask the Cabinet Secretary, because this facility is for American citizens, it does not specify that they come from DRC. What about the Americans who get this disease in the United States? Will they be shipped to Nanyuki because they've said they do not want it there? And who are we to think that we are going to accept all Ebola patients, whether American or otherwise? We want to tell the Americans, I know Kenyans are fearless. I know Kenyans fear nothing. But Ebola is where we draw the line. We are not Wakanda.
In light of the foregoing, we do call upon the community at large in Laikipia County. We do call upon the Christian community. We do call upon the Islam community. We do call upon the Hindu community. We do call upon the business community. We call everyone to come on board and reject.
After this protest came a legal twist in the community. Now, the citizens of Nanyuki were taking their president and the government to court. They argued that the president did not consult the Kenyans about anything. There was no transparency about the Kenya and American deal, and as such, they don't want it in their country. The High Court responded by suspending the project till June 23rd. Let's hear what Dr. Sarah Basola had to say about the current issue.
Thank you so much for having me this evening. For all intent and purpose, it is not necessarily if I support, it's actually the global or public health measures around infectious control. This is the first time this is happening in the world. In fact, for our global north, which is America, a well-established country with more than 10 centers for infectious diseases, really well-resourced technical infrastructure, importing, exporting suspected or confirmed cases or exposed cases of Americans to Nairobi, to rather Laikipia, is unheard of. I mean, worse still is actually the segregation that is happening around this kind of system that they're building, the infrastructure that they're building in Laikipia. It is an American only facility that is going to just treat and take care of Americans only, and they have already started importing their own expertise. The whole world, including our own regional organizations around public health, is really questioning this move and asking if Mark Rubio can say that we do not want Ebola in America. On what grounds do they feel that it is okay for Kenyans to really accept Ebola?
Even when this video from a head doctor in Kenya was speculating, their president, President Ruto, refused to back down on this deal. He spoke publicly on June 4th, defending the project, saying that this project was going to benefit both Kenyans and Americans. He argued that Kenya was acting responsibly. They were just trying to help the other part of the world. The secretary to President Trump, Michael Rubio, was there saying that they don't want any case of Ebola in their country. And then the president of Kenya is saying that they have to act responsibly to help prevent regional health crisis. Nobody in Kenya is infected with Ebola, but they should build the project, they should build the facility in Kenya to help curb regional health crisis. President Ruto emphasized that the facility is going to help and Kenyans are going to benefit from Americans' funding, training, equipment, and health expertise.
I ask the people of my great country that the American people and government have been partners with us on matters health for close to 25, 30 years. PEPFAR and all the other funds. American resources, American taxpayers' resources have been used to support Kenyan health infrastructure. It would be most unfortunate if on one request.
President Ruto claims that they're doing the right thing by helping America set up a facility in their country. On June 9th, another protest erupted. This time around, the youth were more angry. Critics call it risk outsourcing. This issue has continued to inflame public opinion. Citizens of Kenya are asking for transparency. Then everything has been put on a break as everybody is waiting for June 23rd. The whole world is watching. We're waiting to hear what the High Court has to say about this issue in Kenya. Will the president be able to convince his people that this deal between America and Kenya is a fair deal? Let me know your thoughts in the comment section. Do well to like, do well to share, and don't forget to subscribe to our YouTube channel, Finance Podcast, for more finance content like this.